All right. All right. So here we are. We'll just wait a couple of more minutes. And again, let me know if you have any questions. I'll probably look at them at the end and answer them all. But today I'm going to be sharing about stress urinary incontinence. So yeah, let me know. Let's see. Maybe I'll give it one more minute or so. I'll try to lop this off when I do the sharing too. We'll see if I can make that happen. But thank you all for coming. So today we're going to talk about stress urinary incontinence. It's more than just a symptom. I think a lot of times what happens with urinary incontinence and a lot of different pelvic floor, and not even just pelvic floor, but orthopedic problems. We're talking about symptoms, not diagnoses. For example, knee pain is one of them where we do talk about, oh, your diagnosis is knee pain. Well, that's not a diagnosis, that's a symptom. And the same thing goes for urinary incontinence as well. It's just a symptom of different diagnoses. And so just a little bit about me. I'm Dr. Janet Yu. I am a physical therapist specializing in pelvic floor. And so I started pelvic floor physical therapy about 6 years ago as I kind of journeyed into being a mom and having friends who became moms. I kept hearing from some of my runner friends that they had leakage. And a lot of the advice that was given to them was essentially to wear a pad or just stop running altogether. And I was like, no, 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 no. There is a whole subsetting of physical therapy that deals with pelvic floor dysfunction. And I looked for some of my friends, and at the time, there's really just a handful of clinics that worked with people who have pelvic floor dysfunction. So I decided to take some pelvic floor classes. And my background actually is in sports and orthopedics. And so the first 10 years of being a PT, 10 or so years, I've been a PT now for 15 years. I was focused on sports medicine, and I even worked as a physical therapist for Santa Clara Santa Clara University Athletics. And when I took these pelvic floor courses, a lot of the strategies really helped my chronic back, tailbone, hip, SI joint pain patients that I really just started diving into pelvic floor more and more until now. This is my sole focus is pelvic floor physical therapy. And so, yeah, I'm so excited to share this with you. I am also a mom to two kids. I have a 7-year-old daughter and a 2-year-old son. Running is one of my other passions. You can find me running through mostly the northeast side of San Jose. So that's just a little bit about me. Back to understanding urinary incontinence or urinary leakage. So what we're going to learn about today is just what is urinary incontinence? What are the two main causes of leakage? How does poor muscle and fascia impact leakage? How does a weak urethra impact leakage? And that's a little preview for those two main causes. What are the symptoms of the different types of leakage, and what is the difference in treatment? So what is stress urinary incontinence? It can be summarized by the fact that stress urinary incontinence is when an action such as coughing, sneezing, jumping, or running causes greater pressure than what the pelvic floor muscles can handle. And people who are a little bit deconditioned, this high force can be something like sit to stand or rolling over in bed. It doesn't necessarily have to be a jump, a run, a cough, or a sneeze. So to summarize it all, stress urinary incontinence is just when the force is greater than the pelvic floor muscle can handle. And I'm just going to take a little note to say that I do have some pelvic providers that are going to either record or listen to this recording a little bit later. I'm keeping this talk to community facing. So there are some things that we can dive a lot deeper into, but I'm going to keep it as kind of community friendly as possible with the language that I'm using. So Here we go. So there are two main types of stress urinary incontinence, because there are other types of urinary incontinence. We're going to focus on the stress urinary incontinence part. So there is urethra muscle weakness, and that is the outer layer of the urethra. So let me pull this out. The urethra this is the external portion of the pelvic floor. And so this is the vulva, the clitoris, the urethra, and that's where the muscle here is weak. The muscle goes essentially from the bladder down the neck. Where's my bladder? Let me hold it. It's in pieces. Okay. Down this bladder neck. It's technically a little longer than this, but down the bladder neck and out into this urethra. Okay. And so what it is this whole entirety of the muscle here is weak. So that is one main cause of urinary incontinence. The other is the poor connective tissue function. So the connective tissue is altered, limiting the support to the bladder. There is a lot of different structures that help hold up the bladder. And so when something changes about those structures, it can allow the bladder to not have the support it needs to maintain continence. So let me go to this next slide. Okay, so we're splitting this into two parts. What it is the deep pelvic floor muscle. So I pull up my model, and I don't actually have a screen, so I don't know if you all can see me, but so this is a deep pelvic floor muscle. This levator hiatus is actually very important for prolapse, but that's a whole nother topic. So the bladder sits right on top here. And so this deep pelvic floor muscle contracts and it pulls on the fascia to create a firm surface for the bladder to stop leakage. So what happens is these pelvic floor muscles connect to this tissue here, and it pulls on this fascial tissue and it helps to stop leakage. And the other portion is the fascia itself. The fascia supports the bladder where this deep muscle pelvic floor is attached. So those are your two main parts, the muscle and the fascia. So what can happen is the muscle, when it's not strong enough, like we talked about, it doesn't pull on this fascia. The firmness isn't there for the bladder, so there's leakage. And this is the common reason why Kegels are prescribed. So the way I was explaining, it's almost like creating this very taut. Let me see if I can pull one of my daughter's things over. She has a drawing, that's okay. It creates a kind of tension like right across through here a little bit between the bladder and the uterus, and it just and the pubic bone. So there's multiple layers of fascia, and what happens is when the pelvic floor muscles contract, it pulls and it creates this firmness for the bladder. And when that firmness isn't there, it actually is almost like it's floppy, and it won't create that firmness, so that the pelvic floor muscles is not supporting the bladder like it should be. So we want the muscles to be strong, and this is primarily why Kegels are prescribed. But also, the fascia in and of itself can be stretched either with aging or from birth trauma. It can also be torn. So if the fascia is torn, it actually doesn't really matter how strong the muscle is. The fascia is torn, so it doesn't even support the bladder. So this is usually a surgical fix or a pessary. So these are the two different types of that can cause urinary leakage that is related to connective tissue function. So symptoms of poor connective tissue function is that at the end of your day, you would have more leakage when you sneeze and cough. And the reason is as you're standing, as you're moving around throughout the day, the fascia is stretching and it's not supporting the bladder as well as it could be. So it's sagging, and so that you would have more symptoms at nighttime. So when you sneeze at nighttime, you might find yourself hard to hold any leakage in, but in the daytime, in the morning especially, you might be perfectly fine. So that's one of the signs that it's poor connective tissue function. The other is when you leak after consecutive coughs or sneeze. So if you sneeze 3, 4, 5 times, on the 5th one, that you have a hard time holding it because the fascia potentially is being stretched throughout the coughs or sneeze. And so those are the symptoms that you would get with some poor connective tissue function. So the treatment for poor connective tissue function is pelvic floor muscle training. So the best cue for this deep pelvic floor muscle training, this is actually research study, is just squeeze the anus and pull up. I guess a lot of us pelvic floor PTs have divided in our brains the front half and the back half of the pelvic floor. And it's like we tell people to just squeeze the pelvic floor so that you can really support the bladder in through here. But as you can see, the pelvic floor goes from all the way front to the pubic bone, all the way back to the tailbone. So squeezing and trying to activate this whole deep layer that you see is what's really going to support the improvement in strength in the pelvic floor. And this is something that your pelvic floor physical therapist should be able to identify that this muscle group is weak, and therefore you need to train to improve the strength in this deep pelvic floor muscle. Now, the other part, which more is for the connective tissue, like the fascia, is a pessary. A pessary is a little device that you can wear. For our purposes, it would be a ring that goes right on top of this levator hiatus. You would insert it vaginally. There's some over-the-counter pessaries that you can use now that is more like a one-size-fits-all. What we do at Optimized Pelvic Health, I can provide pessary fittings in our office, and that actually is me measuring with my fingers the space in here and compare that to the space at the opening. But again, a different conversation. But we can provide pessaries, and what that does is it supports this area, and pessaries for leakage actually has a little bit of an extra bump, so that when you contract the pelvic floor, it actually bumps the bladder muscle, the bladder neck, to close. So it's forcing it to close with a pessary. So those are the two main types of treatment for connective tissue issues with the connective tissue function, is this deep pelvic floor muscle training with the cue of squeezing up the anus, pull up, so that gets the entire muscle group. We're not just identifying between the front half to support the bladder versus the back half. It's the whole thing. There's thought that when you only think about doing one portion of it, you're doing optimal contractions because it's not the whole muscle group. And then the other part is pessaries to support the fascia. Okay. So there is, however, newer research is indicating that the urethra actually plays a bigger role in leakage, so that if there's something going on either in the deep pelvic floor muscles or the fascia, that depending on what's going on with the patient, with the leakage, that the urethra itself plays a bigger role in the leakage. So now we're going to talk a little bit more about the urethra. So this is one of my favorite things to work with. So there are actually 3 main causes of urethral weakness. There are some other causes. We're not going to go about that today because we don't see that very often. But the first cause of urethra weakness is a nerve stretch from prolonged pushing or during birth or chronic constipation. So there's a nerve that runs in your pelvic floor that gets stretched during pushing of your pelvic floor. The second cause is a nerve compression injury from tightness of the pelvic floor muscles. Lastly, this is actually kind of hot topic at the moment, is estrogen. So estrogen plays a role in the urethra. And so let's explore all of these different causes of urethra weakness. So with the nerve stretch injury. So here's some anatomy. I'm going to try to keep it as kind of community friendly as possible. There is a nerve called the pudendal nerve that winds its way through the pelvic floor. So it comes out of the back of the tailbone kind of weaves its way through the muscles. And what happens is when the pelvic floor muscles stretches, it can irritate the nerve, and the nerve doesn't signal the muscle to contract. This nerve, oh, it's almost like, think about a slinky, where when you pull on it, it kind of can really stretch it. That's what's happening with this pudendal nerve when it goes through the pelvic floor, is that because it kind of wraps in and out around bony prominences, around ligaments and muscles, that when it's stretched, that it can't give the proper signal to the urethra to get it to contract. So this nerve winds its way up into the urethra. And so the causes, like we mentioned, is childbirth. So prolonged pushing at a high intensity causes the stretch on the pelvic floor and subsequently the nerve. And so with this, sometimes it just takes a little bit of a several weeks of recovery to just allow this nerve to calm down and just be not so stretched out and recovered. The thing that we always talk about as pelvic floor therapists in the postpartum setting is managing constipation. And this is one of the reasons why, is that with constipation, whether that is independent of childbirth, chronic constipation causes low level stretch over long periods of time. So daily, if you're having difficulty with bowel movement, and yes, constipation can still be happening if you have daily bowel movements. So when you're having these daily kind of strains on the pelvic floor, it's stretching at a low level, the pelvic floor and the nerve every day for a little bit. And that can irritate the nerve as well, limiting the nerve from talking to the urethra to tell it to contract. So that is the anatomy behind a nerve stretch injury and the causes of why this happens. Take a sip of water. So nerve compression injury is the next cause for urethra weakness. So with the anatomy, this nerve that we talked about actually splits right here at the butt bone. So it actually comes through this little hole, splits right through the butt bone. One of the branches actually goes into the urethra. The other ones actually go towards the vulva and towards the this perineal area. And so what happens is when the pelvic floor muscle is tight, it actually is so tight, it's pulling against some of the attachments that are right here where this pudendal nerve and the perineal nerve runs through. And so what happens is there is a canal here. It's actually called Alcock's canal. This tightness can pull on Alcock's canal, and that can irritate the nerve that runs in the Alcock's canal going to the urethra. So that is one of the reasons why nerve compression injury can contribute to leakage, is because with the compression, it irritates the nerve right here at the kind of the butt bone going towards the front of the pelvis. It can irritate this nerve here, and that nerve goes to the urethra, so it's not going to tell it to contract, so that you get leakage. So some of the causes for this pelvic floor tightness, one of the primary things that I love working with my patients is stress. So the pelvic floor muscles are the only group of muscles with direct nerves from the stress nervous system. So the more stressed you are, the more the pelvic floor responds. Now, I'm not going to get rid of any of your stress. Your kids screaming at you, work things, home things, they're all going to be there. But what I try to do at my office, myself and my PT, is we provide strategies to help bring the relaxation nervous system up to meet the demands of your stress system. And this goes beyond meditation and breathing. This is physiological changes that we're doing for the vagus nerve. The vagus nerve is the primary nerve to help keep us calm. So stress is one of the things that can contribute to this tightness of the pelvic floor that causes irritation to this perineal nerve and and then the branch off, which is from the perineal nerve, from the pudendal nerve. So think of the nerves as like a tree branch, right? It splits off. So pudendal is the primary tree trunk, and then the perineal are the branches. So stress is one of the factors. Constant butt clenching. So we've been told, all of us have been told that we need to squeeze our core muscles to provide stability, whether that's exercises or standing, that we need to activate our muscles. And simply that's just not how muscles work. So what happens is we constantly clench our buttock. And usually when you clench your buttock, it is this low part here. I call it like the bottom butt that squeezes, and along with it goes the pelvic floor, because you're not really just isolating your buttock. It's the pelvic floor too. And so that actually what this constant butt squeezing is what contributes to what's called like mom butt, where your bottom is really flat on the top and there's like this roundness here. That's from this constant butt clenching, because these muscles on top are underdeveloped and the muscles on the bottom are overly developed from constantly clenching. And it might not mean that they're strong either. It's just clenching, not really activating. So again, that tightness irritates the nerve right here, going to the urethra. And finally, another cause for nerve compression is alignment. So we have been all told to stand up really tall. And what that does is everybody stands up, chest out, and our body weight is in our heels. This also contributes to butt clenching. On top of this, a lot of pregnant people and postpartum moms have this form because during pregnancy, we try to get our pelvis underneath this baby bump. And so what happens is then you shift your weight back, your buttock is underneath your pelvis, and you're supporting this baby bump. Or postpartum, we try to create this mom shelf so that we can hold our babies and hold our little toddlers. But what happens is then the butt kind of tucks under our body and it pulls on these deep, it gets these deep pelvic floor muscles to work and contract. Then it compresses the nerve, again, going to the urethra. And so you want to definitely work on alignment as part of like to decrease the tension on the pelvic floor. Okay. The next thing we're going to talk about, and I just realized I've been like holding up my my model and I am not on a window. I think that you all can see me, but we will go over that. I'm going to try to go over this at the end as well. And so with low estrogen, that is another cause for this weakness in the urethra. And so during the immediate postpartum stage, there is a low estrogen state. So that's all these estrogen receptors in our urethra and in the pelvic floor, it's not getting the estrogen that it needs. And so what happens is that the muscle bulk of the urethra relies on estrogen to keep it healthy, to keep the tissue bulky. And what happens is in a low estrogen state, the muscles become thinner and just has a harder time contracting. And so now the low estrogen will rebalance over time. And it just takes, a little bit depending. I have to go back and backtrack and say, none of these happen in isolation. It's some of this, and some of this. So with some people with low estrogen, the people who might have urinary leakage may already have an existing urethral weakness from something, right? So with the low estrogen, it will rebalance over time. It tends to be low as long as you keep breastfeeding. That low estrogen, though, is actually vital for recovery of other things like your fascia, and I'll go into that in a little bit. But this should also mean that, like, as you develop this pelvic floor recovery program with your therapist, that this is something to keep an eye of, because it may not be 100% of the reason why you might be having leakage, but some of the signs are, let me go back, some of the signs of low estrogen actually would be, if you have your period, it would be cyclical, um, cyclical leakage and also vaginal dryness. And I know I have slides on this coming up. And so for all these reasons, this is why it's important to find the underlying cause of urinary incontinence. As you saw, there is at least 5 different ways or different causes, different factors that you could be experiencing urinary leakage. So at my office, myself, my PTs, we are able to assess and treat the different diagnoses and treat it for the specific cause. We do our internal pelvic floor assessments to really find out what is that deep layer doing, what is the external layer doing, and trying to really find what is driving that leakage. So let's go into this a little further. So what you would feel with a nerve stretch injury, you would probably feel symptoms that worsen after having a bowel movement or constipation because the nerve is being stretched. For this, I know before I mentioned that the nerve stretch injury can also occur in those who have just had a baby. Typically, the nerve injury should recover in about 6 to 8 weeks. So depending on just how severe the nerve injury is. Now, there is actually very, very new research to show that that nerve that we're talking about, the pudendal nerve, can benefit from estrogen as well. But again, estrogen is something that needs to be discussed with your doctor. There's so many oversights to that I'll touch base when we get there. But for the nerve stretch injury, symptoms would be worse after a bowel movement. And hopefully, if it's a stretch injury, that in the first 6 weeks or so, you always slowly start to get better after giving birth to a baby. Nerve compression injury. So when the nerve is compressed, you would probably get worse symptoms after workout, meaning, and we're talking about like squatting, lunging, lots of like hip strengthening workout where you've been told to squeeze your butt. So if you happen to cough or sneeze during your workout or immediately thereafter, if you have a nerve compression injury, you would have leakage with the cough or sneeze after, and in increased times of stress as well, because when we're stressed, our body tends to clench, especially our pelvic muscles, and that clenching of the pelvic muscles is what's compressing that nerve going to the urethra. And again, low estrogen. So what you would feel is cyclical leakage. So if you have a 28-day cycle, you would have leakage 27, 28, day 1 of your cycle. That could be with vaginal dryness, maybe some atrophy, which means that the muscles actually are thinning. This is a process of an elimination. I don't usually think it is low estrogen unless we rule out some of these other causes. And there is some cyclical leakage, and the patient tells me that their vulva feels dry. So that is more a process of elimination. So again, the treatment for that, for the nerve stretching component, would be pelvic floor muscle relaxation strategies to manage constipation, food and nutrition changes. The pelvic floor muscles wrap around the rectum. So when they're tight, it's like a chokehold on the rectum, making it harder to have a bowel movement. And one of the things I did not put on here is like using a squatty potty would probably help because it opens that up as well. That opens up the angle of your rectum so that you can have a smoother bowel movement. So nerve stretch injury, the primary thing that you can do is constipation. Will keep estrogen as like a back burner thing. That's something that's very new, like I mentioned in the research. For nerve compression, this is actually probably, honestly, the most common that I see. Nerve compression, where the nerve that goes to the urethra is caught in the tightness of the pelvic floor muscles at, again, what's called the Alcock's canal. So all these pelvic floor muscles are super tight. It tugs on this attachment point of this connective tissue called the Alcock's canal. and it limits the nerve to signal the urethra to close. And so you want to make sure you do relaxation strategies. My favorite is actually the basic exercise, and I'll come off screen at the end of this to share some of the things with you. Alignment, again, making sure that when you're standing that you're over your feet and not weight shifting back into your heels, that clenches the pelvic floor. And I just put this in your superficial pelvic floor muscle training that can really help to, that we can really isolate that superficial pelvic floor muscle layer, because actually the deep pelvic floor muscle layer and the superficial pelvic floor muscle layer, they come from different nerves. So you can train them independent of each other. Pelvic floor stretches. So honestly, any exercise can be a pelvic floor exercise or a stretch, or at least the ones that target the glutes and the core. So with pelvic floor stretches, I like to give like a deep squat, a cat-cow, child's pose, but with the cue to widen the sits bones. Your pelvic floor lives in your sits bones. And so when they widen, you're giving that a stretch, and then you can do this nice inhale breath into it, and that will give that a stretch too. Glute strengthening. So making sure that when you're doing glute strengthening, that you're really strengthening a good balance between the top portion of the glutes versus the bottom, so that you really have this balance pelvis, pelvic floor. So with the glutes strengthening, it's never squeeze your butt, clench your buttock, squeeze to lift up. It's actually combined with the alignment, press through the front of your feet, and with widened sits bones as you come down, and then as you stand back up, narrow the sits bone back to normal. Again, we talked about topical estrogen as the last treatment for urethral weakness. This is a discussion that you will have with your OB, but quite frankly, it depends on their knowledge about how topical estrogen can impact your tissues. Because here's the thing, topical estrogen, or estrogen in and of itself, can change collagen in our connective tissue. This is actually the main reason why there is so much laxity during pregnancy in our tissues, is because of estrogen. I want to say, like, during pregnancy, the estrogen that you'll have during your pregnancy is greater than the rest of your lifetime, and that's a singular pregnancy. And so it is the heightened estrogen is there to stretch your tissues and stretch your fascia. So that also means that if you have some type of fascial disruption component to your leakage, this actually may not be a good a good resource, because even though there might be some estrogen things going on, that is making your urethra not as bulky, if you put on topical estrogen, it can impact the fascia. So I do this in my office, where I'm able to at least discern how much fascial disruption there is, or disruption that can impact urinary leakage. So we tease that out and have this discussion of whether topical estrogen would be beneficial or not. And then have you have that discussion with your OB. And I put this at the bottom, all of these different causes of urethral sphincter weakness can benefit from urethral muscle training. And for my PTs that are on and will be listening to this, that is because your first layer, your bulbocavernosus and your urethra actually have this, it's the same nerve, it's that perineal nerve. So if you can detect this outer layer tightening, you can infer that the sphincter is working. So some of the cues for superficial pelvic floor muscle training would be close your vulva, nod the clitoris. Those are the two main ones that I use. I'm sure there's many others, but I like that one. And when I train this with my patients, I am right there at the vaginal opening at those muscles to make sure that they're firing and functioning. And you should be able to, as a pelvic floor PT, we should be able to tell you what the deep layer is doing versus this outer layer. So the superficial muscle, pelvic floor muscle training is good. So when you're working on this at home, think vulva closing or clitoris knotting, and that can all benefit, like all these different types of urethra weakness can benefit from this urethra muscle training via this outer layer. So of vulva closes, and it's a thought, it doesn't actually close. There is some movement, but I'm sorry, vulva closing or clitoris knotting down. So that's the treatment for that. So here's an overview. So there are two main causes of urinary leakage. That is the first one that we talked about is this connective tissue, where you can have either fascial disruption, which the signs of that is more leakage at the end of the day or with consecutive sneezes, coughs, whatever. That is the best treatment for that, if there is actual fascial disruption, is a pessary. And then the connective tissue, where there is weakness in the deep pelvic floor. Usually this is just leakage with high force types of activities, or just your general leakage symptoms. This is something that we have to tease out as pelvic floor therapists for you. But with this, it would be deep pelvic floor muscle training would be the treatment. Summarizing urethral weakness, it can be from pelvic nerve stretch. And the signs of that is just this leakage in early postpartum that should recover in the first 6 weeks on its own. There is, again, something on the back burner that estrogen can help it. It's such a hot topic and so many new things about estrogen that we don't know. It can help. That's what the research shows, but there's not a lot of research on it. So I don't think people are actually using it. Or having leakage after a bowel movement, especially when you have constipation. Those are signs of a pelvic nerve stretch injury. And treatment for that actually is lifestyle changes, improving your bowel movements, and just making sure that you're not straining down on your pelvic floor. Pelvic nerve compression is also one of the causes for urethra weakness. This is just tight pelvic floor, or I should say painful pelvic floor leakage after workout or during high times of stress. The treatments for that would be any pelvic floor relaxation, stretches, general relaxation strategies, alignment like we talked about, and some glute strengthening. Low estrogen, lastly, is one of the main causes for urethra sphincter weakness. This low estrogen, signs of it is cyclical leaking, meaning that you leak at the end/start of your period, or vaginal dryness. And this is something that we would have you talk to your OBGYN about. So again, what I didn't necessarily talk about for urethra sphincter weakness is actually a direct urethral injury. That is one of the causes that I've seen where possibly doing some type of catheterization, the inside portion of the urethra was damaged. So again, that is another way that a leakage or urethral sphincter can happen, causing leakage. So let me say that again. One of the ways that is not listed that can contribute to urinary leakage is damage to the urethra, and that's the inside lining, usually doing catheter removal. It damages the inside, so it's a little bit harder for you to hold a contraction. And just to throw it out there, the treatment for that would be urethral bulking agents, where this agent, I don't want to say chemical, this substance is injected into the urethra to make it a little bit bulkier. So that is another cause that we didn't dive into. It's not very common. I think in all the years that I've practiced, I've seen one where I am. And so with all this, it is never just one thing, right? Somebody could have deep pelvic floor weakness and also this pelvic nerve stretch or something like that. And a lot of the times it's not one thing that's causing your leakage. It can be a couple of different things just depending on what we find in an internal assessment, what your symptoms are, what signs that you report back. And so a lot of times too, we talked about that essentially for the urethral weakness portion of it, that you can just generally strengthen that urethra. A lot of times it can be general atrophy and coordination. So I've had people who, after we worked on releasing their tightness in the pelvic floor, they got some improvement of the outer layer contraction. So I can assume the urethra is stronger. And then from there, training just the contraction itself along with coordination improves it even further. So again, it's not just factor. And so that is all I have. That was my summary slide. Let me go back. Let me come out of this. So I am Dr. Janet Yu. I'm at Optimized Pelvic Health here in San Jose. My Instagram is Optimized Pelvic Health. I should have put that all together. I just realized I typed the name, but I'm going to stop this screen share. Okay. Let's see. There we go. Okay. So what I was talking about, let me go back to this, is a lot of times with mom butt. So this is the pelvic floor. I might even, let me take this. Okay, so with the pelvic floor, what tends to happen is when we're told to clench our butt here, these pelvic floor muscles go with. So these muscles are really tight. So that doesn't allow good movement of the nerve that's within the pelvic floor, that pudendal nerve. And what happens is this upper portion of the glutes, it gets a little bit weaker. That's where we get the mom butt, where it's really flat up top and then it rounds at the bottom. I talked a little bit about this urethra and the bladder. So the urethra that we're talking about is essentially like this bladder neck urethra muscle, and then this outer portion here. Let me know if any of you have any questions or concerns. Actually, I should answer one. I did get one via email, and we did cover it a little bit. It was asking about going into stressful situations that this person has more urinary leakage. And I have to say, we have to really differentiate the difference between urinary urgency and your stress urinary incontinence, because urinary urgency is a little different. What that is, essentially you have this urge to pee and you just can't hold it and you gotta go. Whereas stress urinary leakage is you jump, cough, sneeze, and you have leakage because of that high force. So going into stressful situations, that can be a cause for urinary urgency as well. What happens with the nerves is essentially when you're stressed, these nerves get really irritated. A lot of these nerves end in your pelvic floor close to the bladder. Your bladder is just kind of have this heightened sense, and it just makes it feel like you have to go. It's like irritating it. So that could be urinary urgency. And then with urinary stress urinary incontinence, yeah, so with stress urinary incontinence, it can also be from stress, and the stress levels are what is contributing to that tightness in the pelvic floor. So the biggest thing that you want to do with that is, before stressful events, really try to work on some of these stress management tools. Oh, that was right. So I talked about doing this basic exercise. This comes from osteopathic medicine. If you're a patient of mine, you probably got this, where you interlace your fingers, put your hands at the base of your skull, give your neck a little bit of a stretch, and look to one side. And you look to one side until you feel this like sigh, yawn, deep breath, or double breath occur, because that is releasing the muscles that's pushing on the vagus nerve. The vagus nerve is the primary nerve to help keep calm. And then you can do the other side. Other things I would do if it was kind of stress related, like stress urinary incontinence, is doing things like child's pose and just working on breathing into the pelvic floor. Inhale into the pelvic floor, right? When you inhale, this almost widens and gives this whole area a stretch. And then either in child's pose, cat cows, any of those to kind of bring this relaxation response to your body. So a lot of times it depends on if the leakage before stressful events is coming from the tightness of the pelvic floor because you're stressed, or because the stress nerves themselves that are close to the bladder is like essentially telling it that you need to go. So those are the two main things. But if it's stress urinary incontinence, again, the major factors for that, or the major exercises I would have someone do if they're getting stress urinary incontinence before things that are stressful, would be relaxation strategies such as the basic exercise, trigeminal nerve stimulation, which I like doing gua sha. So I have my patients either get a jade roller or gua sha, because the trigeminal nerve is an indirect nerve relaxation, stress nerve relaxation strategy. And then the exercises would be child's pose, breathing into the pelvic floor. Really think butt bones wide. I tell people, imagine that you have, your pants or whatever you're wearing have back pockets. And as you inhale, your back pockets widen from each other, and it creates this wideness, this stretch in the pelvic floor. All right, let me double check. Okay. Let's see. Any other questions? Okay. Yeah. So somebody did, yes, this was one of the questions I got. It is for urgency. So yeah, I think a lot of times it is just that stress management, how to bring the relaxation up to you. All right, it was great chatting with everybody. I'm going to end this recording now. If you do have any questions, please send me an email. I'm sorry, it's long. It's Dr. Janet at Optimize Pelvic Health. We will see you hopefully at the next webinar that I host. I have yet to pick a topic. Have a good day. Bye.